Have you ever felt a persistent, unexplained discomfort in your abdomen or noticed changes in your digestion that just would not go away? It is natural to wonder what might be causing these concerns, especially when our internal organs are involved. Understanding how doctors investigate conditions affecting vital organs like the pancreas can bring immense peace of mind and clarity. When it comes to detecting pancreatic cancer, there is not one single test that gives a definitive diagnosis. Instead, doctors relying on a comprehensive approach, combining various diagnostic tools like advanced imaging scans, specific blood tests, and ultimately, tissue biopsies to accurately identify the presence of cancer. This multi-step process helps paint a complete picture of your health. The reason a single test is not sufficient is due to the pancreas's deep location within the body, making it difficult to examine, and the fact that early symptoms of pancreatic cancer can often be vague or mimic less serious conditions. This is why doctors start by looking for clues. Imaging tests such as a computed tomography scan, also known as a CT scan, or a magnetic resonance imaging scan, an MRI, are crucial because they allow doctors to visualize the pancreas and surrounding areas in great detail. They can reveal tumors, blockages, or other abnormalities. Blood tests might check for liver function, bilirubin levels if a blockage is suspected, or for certain tumor markers like CA19-9, although it is important to remember that this marker is not definitive on its own and can be elevated in other conditions. Finally, a biopsy, where a small tissue sample is taken and examined under a microscope, is the only way to confirm a diagnosis of cancer. So, what does this mean for you if you have concerns? The first and most important step is to openly discuss your symptoms and medical history with your primary care doctor. They will evaluate your situation and may recommend initial tests or refer you to a specialist, such as a gastroenterologist or an oncologist. The diagnostic journey often begins with blood work and less invasive imaging like an abdominal ultrasound. If these tests raise red flags, your doctor might then order more specialized imaging like an endoscopic ultrasound or an EUS, which uses a flexible tube with an ultrasound probe inserted through the digestive tract to get very close to the pancreas. Another possibility is an ERCP, or endoscopic retrograde cholangiopancreatography, which is both diagnostic and can be therapeutic for blockages. Remember, each step is taken to gather more information and narrow down the possibilities. One of the most advanced imaging techniques used to detect subtle changes is the endoscopic ultrasound, or EUS. This procedure provides extremely detailed images of the pancreas, sometimes even better than external imaging, and allows doctors to perform a biopsy during the same procedure. Furthermore, the role of a multidisciplinary team is vital in pancreatic cancer diagnosis and treatment. This team includes surgeons, oncologists, radiation oncologists, radiologists, and pathologists, all working together to review your case and ensure the most accurate diagnosis and personalized treatment plan. This collaborative approach means you benefit from multiple expert perspectives right from the start. Navigating the diagnostic process for pancreatic cancer can feel overwhelming, but understanding the steps involved empowers you to be an active participant in your health care. By communicating clearly with your doctor, asking questions, and following through with recommended tests, you are taking the best possible steps toward clarity and maintaining your pancreatic health. Early detection, while challenging, significantly improves outcomes, making your proactive engagement truly invaluable.